We have a society that has been really treating our Black patients in a way that is inequitable.
When you come here, you do it because you want to see a doctor, a nurse practitioner, someone who knows more about your health than maybe you do. But more hospital systems are now incorporating patients as the center of their care to reduce maternal mortality. And it all starts with something as simple as how we talk to one another.
We're going into 8 for our teen birth huddle.
You're about to witness something intimate.
Hi, Madeline. Are you comfortable? You can sit up some. We just don't want you walking yet.
Madeline Young is 39 weeks pregnant, and right now she's meeting with her care team at Cleveland Clinic Akron General to go over the plan for the final week of her pregnancy.
We typically also will do what's called delayed cord clamping, where we give at least a minute before we cut and clamp the cord. And that just allows the blood that's in the placenta and in the cord to get back to baby girl. So as long as she looks good, we'll do that. Would that be okay with you?
Yeah.
Nothing about this conversation might feel out of the ordinary, but after a little backstory, you'll better understand why these conversations are new and a part of Akron General's larger plan to save lives.
There is something about that communication and that decision making when the provider and the patient are doing that together that their outcomes are improving.
According to the Centers for Disease Control and Prevention's latest numbers, 1,205 women died of maternal causes in the United States in 2021. In 2020, that number was 861, and in 2019, it was 754. Black and brown women comprise most of these deaths, as they are 2 to 3 times more likely to experience complications during birth. Experts and researchers say a major reason for that is generational trauma, where distrust of the healthcare system can contribute to anxiety and depression, which leads to worse outcomes for both mother and child.
We have a society that has been really treating our Black patients in a way that is inequitable. And that's because of things like historical racism, systemic racism, economical biases.
Dr. Jennifer Savitsky is the chair of the OBGYN unit at Cleveland Clinic Akron General and has seen it herself. She says where a white patient might feel totally fine receiving care, Black and brown patients might feel apprehensive since they're entrusting their health and their baby's health in a system they might feel is not working in their best interest.
Trying to do as much not medicine as possible.
Okay.
It's why these conversations are so crucial, so patients can better understand what is being done to them and why, and direct care teams on what they're comfortable with.
That creates a whole new foundation of trust and dignity for those patients. And we know that lack of trust is a major driver for why Black pregnant patients do not seek care or do not engage in care.
Here, the program is called Teen Birth, and Cleveland Clinic Akron General is one of 4 hospitals nationwide that have been using it for the last few months. And the thing is, it's working, as hospital satisfaction survey results have risen tremendously since the program started.
12 weeks early, they didn't even hand me my baby. So now I'm hearing that I'm gonna get to hold her as long as there's nothing crazy. It's just hearing all that is good.
Do you think this is saving lives?
I think that it will eventually save their lives, yes. Yeah. I can say without a doubt that we are improving the relationships that we are having with our patients, and our patients are feeling like they are in control of their own health care.
Isn't that funny?
These are moments that can feel uncertain, even scary to some patients. But with something as simple as communication, healthcare workers hope they can create better outcomes for their patients. Dan Grossman, Scripps News, Akron, Ohio.